Hello, everyone. It's really nice to see you guys on here. For those of you who don't know me, my name is Dr. Vivian Asamoah. And if you're watching this, it's probably because you're a subscriber to our YouTube page or gonna be subscribing soon, or you're part of our Back to Basics Natural Gut Relief in Facebook, where we host live interviews with amazing guests. And today is no exception. You guys are going to be really excited to meet Dr. Tolu Olabintan. Am I saying it right, Doc?
Olabintan, that works. I take it.
Olabintan.
Mm-hmm.
No, we'll say it right. And she is an amazing family practice physician based in Mansfield, Texas. Her practice is called the Livingspring Family Medical Center. And I just want to say she's probably one of the most phenomenal primary care doctors that I've ever met. So it's an honor and a pleasure to have her here. And I'll tell you guys why I invited her on our show today. But for now, I'll give her the floor so she can tell you even more about herself.
Well, thank you so much, Dr. Vivian, for the privilege of being here. I'm honored and delighted to be here. But I'm Dr. Olabintan. I am a wife, mama, Christian, foodie. I enjoy eating because in all our conversations, I want to make sure that's clear. I'm also a private practice owner in Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. Yes, in a nutshell.
Wonderful, wonderful, wonderful to hear. So now I kind of got your spiel about the practice. Yes, Tell us a little bit about you and your journey in becoming a primary care physician.
All right. My journey to family medicine was it wasn't quite direct. So when I was younger, I knew I liked taking care of people. Initially, I thought I wanted to be a nurse because the uniforms were cuter. They had a little white hat and stuff. And I was like, oh, this sounds like something I could do. But then I would see that the doctors were the one telling the nurses what to do. And I'm like, I like that better. So I decided I'd be a doctor. And then, watched a loved one, an auntie, die from asthma, grew to learn that that's not something you should die from. And then it sealed like, okay, I definitely want to be a doctor. But I went to medical school thinking peds, so that I would take care of kids. And then fell in love with family medicine. I met a doctor towards the end of my third year who took care of a 90-year-old patient, his daughter, her kids, and then the new grandkids. And I was like, can you imagine the transgenerational impacts she's had just taking care of the whole family? And I was like, I like that. So I settled on family medicine and no regrets since.
Yes. That's phenomenal. Yes, I can imagine actually seeing a whole generation of a family. It makes you really feel like you are changing a community. It really is, right? That's really wonderful. And guys, you guys may be wondering, like, why is she? What does this have to do with natural gut relief and gut health and whatnot? But you'll be surprised to know the number of patients that ask me about recommendations for a good primary care doctor. And sometimes I'm kind of stumped because I'm like, oh, it's actually a very tough recommendation to make because of so many reasons. And in my head, I said, well, okay, let me think of who is my ideal primary care doctor that I'd love to go see. And I was like, I want to be part of Livingspring Family Medical Center. I want to be Dr. Olabintan's patient. And we're going to dive into how you pick your primary care doctor. What are the things you should be looking for? How you make that decision? Because sometimes patients feel like it's just my insurance told me to go there, but you do have a say. Yes. And you can even pick from maybe 5 that maybe your insurances have sent you to, and you pick the ones you want to pick. So I want you guys to listen a little bit to how Dr. Tolu Olabintan, like how she approaches her practice, what she does differently. And then you start aspiring for, yeah, I deserve this. I want this kind of care. I deserve this kind of care. So let's start with, we always hear this term, patient-centered care. And I know that's something you definitely focus on in your practice. What does it mean to you, Doc? And how do you integrate it into practice?
So patient-centered care is where the focus is on the patient. So how can I improve the patient's quality of life from where they are? And for me, I'll be honest with you, it's been a journey. So my usual approach had been, you got to do this, you got to do this, you got to do this. I'm the doctor, because that's how we were trained
Yes.
to take care of patients. Oh, you should eat healthy. Oh, you should not drink soda. Oh, you should do this.
Mhm.
But what I found out is that patients respond more when they're empowered to see why certain changes are important, and then coached to make those decisions themselves once you get them sold on their why. All right, I'll give an example. I had a patient who years ago, I used to tell myself, if you smoke, I feel ashamed saying this now, but I'll be honest, like if you smoke, I wouldn't see you, because for me, you're shooting your own foot.
Yes.
But if you told me to give up, like I have a habit of playing with my ear, or I have other habits, not too proud to show up. Yeah. If you told me to give up some of those things, it's not natural. It's not an easy feat. It takes time. I do it as a way to self-soothe.
Yeah.
So I understood with smoking, you're deep breathing, right? It's a habit. It's a way to de-stress. If I took that from you, what would I give you as an alternative? So it then started to change how I ask questions like, okay, why do you smoke? So not let me yank it from you. It's okay. What can I replace it with that works for you? Same thing. I would show my patients, your A1C went down. Yay. And then crickets. Well, good for you, doc. The A1C went down. Don't feel any, I'm not sure I feel any different. I'm not sure the medicines are working for me. I have diarrhea from the medicines my doctor put me on. But yeah, the A1C is. So then I started asking questions like, well, how do you feel? What's important for you? Where do you see yourself? What are your health goals? So it's my medical knowledge, yes, but it's what's a priority for you? How can we meet the needle so it works for both of us? Because I'm like, oh, I wanted you to live long and well, but they're like, well, I'm living a long, miserable life.
Yes.
So no. So it's okay. How can I make that better for you? So it's patient-centered.
Yes.
And so as you look at the patient-centered, then even from the front desk to the back desk, you are sure that it's patient-centered. So that's why at our practice, I've had my teams called by a friend. I said, call the clinic and try to get an appointment, give me feedback. Just to test,
I do the same too. I do the same.
Like, are we showing?
Are we
care
doing okay? Yes.
On the phone line. So it's where it's the patient, and what can I do to maximize the patient's visit while they're there, even in that short time, however long we get to spend. Yes.
That is really very important, and the way you phrase it is very important, because I think when the insurance connects with patients, it's about, and they talk about patient-centered care. I think they're talking more about patient-centered metrics, right? They're just looking at numbers. They're asking physicians, especially primary care doctors, have you checked the A1C? Have you checked the lipid panel? Did she get the wellness visit? Did she, has she had the osteoporosis screening? They're just checkbox. But what you're doing is like, okay, that's all important, but I really have to understand what this means to my patient, what this means to their quality of life. Is getting their blood pressure under control going to make them feel better when they go to their daughter's wedding because they don't have headaches, right? Do they feel like it's a win because they're able to play with their grandkids because they lost that 15 pounds, right? So you're really making that connection directly for the patient. So it's their health. They value how it's really impacting the quality of life. And that is phenomenal. That is really great. So this is one thing that I think is probably different to maybe some other primary care practices. And I'm thinking in that selection, one thing that makes you stand out is you're able to decide the kind of care, truly the kind of care you want to provide. You are not really like super controlled by the insurance companies. It's to a certain extent, yes.
Yeah.
But I sometimes feel that doctors who stay in an independent private practice model have the autonomy to decide the best quality, really select the best quality kind of care for their patients without having been told by a larger institution, insurance company, what to do. How do you feel about that in terms of primary care and how it impacts your practice?
I would say, I've seen the difference. Number one, even in staffing. I remember working for bigger hospitals, and I'm like, the team members I have don't care about patients. Like, they make patients feel uncomfortable. We need to switch because the atmosphere or the temperature or the whatever the gauge is, like the atmosphere of the office is not conducive for everyone to thrive. And then empower patients, but they're like, no, this is who we have. You
The
just
culture of the whole
the
place,
culture,
right? Yes, the
yes, the
culture.
culture of
Yeah.
care, the culture of, and so that's one aspect where I'm like, okay, you know what? When I open a practice, even though I never thought I would, I was like, I would not want that,
Okay.
and then there's I can spend as much time as I need to with my patients because it's my practice. I can also incorporate other things that sometimes may not be mainstream. Spirituality is a big part of my practice. And so I've had patients say, you know what, doc, would you pray for me? I'm like, open with it. Sure, we'll do that. Or I've been able to say, you know what, go listen to this podcast or go listen to this. And, so I'm able to think outside of the box more because I'm not so structured and I tailor it to the patient. And I'm not saying nothing against I shouldn't say nothing against big hospital systems, but as someone who has my own private practice, I can custom it to what I find to be very, very important and what resonates well with me. And so it's more a purpose, not just I'm working for someone. This is
Right.
what I'm called to do. So,
Yeah.
I would say if people are picking practices, you want to look for something that's a little more homey
Okay.
for you.
Yes.
And that's the
Yes.
difference between hospital-based and primary and privately owned.
So I like that word homey, right? We never really think about our family physician. I mean, we should. We used to back in the day, we would have the same primary care doctor for 30, 40, 50 years. Things have changed so much. And so going back to that, I think is extremely important in terms of when you're looking for a primary care physician. Some of the things that I've heard that I can communicate to my patients is look for someone who's really focused on patient-centric care. When you go and speak to them, they're speaking your language. They understand you. They're getting to know you. They're getting to know about your family and all of that stuff. Observe the staff. Is this a staff that cares about patients? What is the culture in the practice feel like? Are they just picking, oh, Mr. We're not, bye. But are they picking up and saying, hi, Stacy, how are you today? Oh, we haven't seen you in a while. Thank you for coming in. So observe the staff, right? And then look at a doctor who is also giving you more than just cookie cutter sheets. This doctor is sharing podcasts with you. Dr. Tolu is, praying with you if that's your spiritual belief. She is sharing information that, may even be confusing out there in social media. There's so much out there, but she's actually giving you specifics and concrete information. So that's also really important. Another thing you mentioned is crafting the time you need per patient. You may find one patient may need maybe a little older, maybe even younger, but needs more time to discuss their issue. And then with another patient, you can move fast, you can move swiftly because you know what's going on. So it's not cookie cuttered. So that I hear a lot of that personalization, not just from your care to the patient, but also from the patient's response to you. You seem to have a personal relationship with every single patient. Like they're like your, doctor buddy. That's homey, a friend, right? Right. A friend you can take home with you and introduce to the rest of your family. That's the kind of family care doctor you want, right? So that's truly phenomenal. That is really phenomenal. Is there something else that you feel that you do differently to other practices that really helps the Livingspring Family Medical Center stand out in Mansfield, Texas?
I would say the biggest thing is, for us, the culture of care, which I've mentioned before. Two is asking you what you want and, selling you on you. So I'm very big on what do you want? What's important to you? What's quality of life for you? And then the other thing is not just the body approach, the mindset piece. I'm big on mind, spirit, body.
Okay.
I've seen a lot of, people's perception about their health affects their outcome. So if you think because your family history had high blood pressure and diabetes, you're stuck to it. I'm here to change the narrative. Like, no, I've seen the contrary. I've seen people say, because I saw that, I don't want that, so I'm going to do this.
Change too.
Yeah. So it's empowering and changing the narrative, mind, spirit. So I've told patients sometimes, I'm like, you know that maybe you inherited the habits, not the disease actually. So I found a lot of it is the habits and the mindset around that. So that's what also sets us apart. And then 3, it's like we find if we're a good fit. I'm very big on, let's check, is this a mutually beneficial relationship, patient doctor relationship. I've had patients schedule a televisit just to meet me.
Uh-huh.
And they tell me, yeah, I'm just here to check you out first before I come into the clinic. And I'm
Ah.
yeah, so they even ask me questions. Why did you go into medicine? What, and I'm like, wow, it's different. I've had people say, give me the heads up, like, I'm just here to kind of test you out. I've had really bad experiences with doctors, so I wanted to see if this, and I'm like, that's fair. I want to answer to the best of my ability, and so go over their medical concerns, and then, and I've had people ask me, what's your approach, to medication use plus supplements plus this. Well, it's case by case, and I answer the questions to the best of my ability, but I want it to be, I'm not out to just take you as a patient. I want to make sure this works for you too.
Excellent. Yeah.
Yes.
Yeah. Dr. Tolu, I just had a brilliant idea that I think you should do. I think you should either write a book or start off with a little checklist as to how to find a good primary care doctor. You know how they say how to find a good house? How do you get a good house? How do you find a good husband? There's a checklist for that. You need to do the checklist on what are the questions that I should ask, right? What do I look for in a good primary care doctor? There you go. PDF resource for you right there to create.
That's a good one. Thank you.
I think a lot of people will need that. Like, I love some of the approach that you have, where a patient just even calls you and said, just wanted to meet you. Where did you go to medical school? These are questions you do want to ask your primary care doctor, because when you find that great primary care doctor, you want to understand what their philosophy is,
exactly.
Right? You want to make sure that their philosophy aligns with yours, or that it's somebody who also inspires you. And I want to say that I think that's something you do extremely well. Not only do you provide care, right? Not only do you coach, but I think you also inspire your patients. And that's a huge, huge plus, right? To be able to go and sit and be excited to go see your primary care doctor, because you're going to leave that office. I'm sure when people leave Livingspring Family Medical Center, they're a little different. They're a little changed. There was a little light bulb that went off somewhere, which is phenomenal, which is great. So tell us, what feedback do you receive from your patients when they start working with you? Someone who's new to your practice, or even someone who's been there for years. What do they tell you is the reason they keep coming back?
For some, it's the atmosphere. They say there's something in the place.
Do you dance?
Do I dance?
You dance there. I've seen you dance there, like right in clinic, right?
Okay. I do random bursts of like dancing, and I try to do it, behind the scene, and they're like, there she goes dancing again. It's to keep my pep in my step, and you also feed my joy. But I've gotten feedback the atmosphere is good too, that they actually sincerely feel cared for. Okay. That we look like we enjoy. They're not a burden to us, and that for me is big. I've had people change the trajectory of their family, so their husbands are exercising now, or they're taking family walks together based on ideas we talked about. How can we make it worth it for you? Some of these lifestyle changes. I've had some say, they quit smoking or quit drinking. Some have bought houses because of some of the things we talked about. Some have dared to actually start running. Some have started doing things that they've never considered doing before. So it's and it's a team effort. I want to make sure.
Yes, of course. All of this, right, is definitely
it's a team
yes.
effort. So we're very big also on the kind of people we allowed to work at the practice, that you understand the culture of care, and it's something that would also be good for your health. Working with us.
Fantastic.
So,
that's awesome. So, Doc, do you have a primary care doctor, and were you as selective in picking your primary care doctor?
Man, that's a good question. So I do have a PCP. I'm so
good. That's good, because most docs don't have one. I will say, so far, my gynecologist is my PCP, and she keeps telling me every time I go, she was like, V, you need to get your own doctor. I cannot be your. You're not having any more kids.
I have a PCP. I looked into her reviews. So her reviews were good. Her philosophy aligns with mine as far as using lifestyle medicine as
Mhm.
well. She came highly recommended. Actually, someone referred her to me, and I was like, okay, sure, I'll try. So I go to see her for the first time actually this week. Yeah.
Fantastic. That's
Mhm.
great. Awesome.
Yeah.
So you'll be kind of eyeing her out and kind of checking what is she doing? What is her staff doing? What's that? That's wonderful. Now, Doc, a final question before, well, two more questions, but
Okay.
I want to bring up the fact that there are some difficult patients out there. It's not going to be rosy and lavender smells every day and everybody singing kumbaya at the practice. We know that there are going to be difficult situations, and there are going to be, I don't like to call them difficult patients. I like to say different kind of patients that we encounter as well, right?
Yes.
How do you handle and how do you empower your team to handle such situations where we never want anyone to leave feeling bad, upset, disrespected, or sad? This is really important in every practice, but I think in primary practice, even more so, because that's a long-term relationship sometimes, right?
So we role play. So we have meetings every morning where we empower each other for the day and like, rah, we're going to do this day. And I tell them, I give examples of some of the difficult patients I've encountered where, sometimes for my color or for whatever reason, before they even met me, they're ready to,
So by your color, you mean your race, the fact
yeah,
that you're Black,
yes.
some people,
Yes, I've had
yeah.
some difficult encounters, but one of the things that grounds me a lot, like I've said, my faith, big deal, because a lot of times when I go to work, I know it's an assignment, it's a call-in, so there's nothing that's going to tick me off today. Like
Mhm.
it's a front. It's like there's no one, like it's not worth my joy. So that's one, and then
Mhm.
two, I say people tend to do that to test to see if this is a place for them, to test to
Mhm.
see if we really care or we just say nah.
Mhm.
So,
Mhm.
so usually I get the feedback from the front, the heads up, this
Mhm.
person, da, 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 da.
Yes.
So there's okay, nothing's going on. And I go in and I say a little prayer. And then I go in and I ask, first, hey, nice to meet you. Who do I thank for meeting, the pleasure of meeting you? And then I ask, I did get feedback. Now I discern when to do this from the team that I just want to make sure everything okay.
Okay.
Like I just want to make sure that we're on the same page. One, to let her know that I do get feedback from my team and I take it
Yes.
seriously,
Yes.
and also to let her know, like, we're here to help you. You tell me how I can help you.
Mhm.
So there are situations where, yes, maybe there were some issues on the front,
Mhm.
miscommunication that we have to address. But I tend to find that, people don't mean to be mean sometimes. It's
Mhm.
just is how they come across, and that's a
Mhm.
personality type. So when you understand people's personality types, then you adjust.
Mhm.
Now there's some places we've got to say, it seems that everything we do here you don't like. Maybe we're not a good fit for you.
Mhm.
So, and some will say, oh no, okay, let's start again. And
Yeah.
some will say, okay, I say, take time, reconsider, and see. Like, this is how we do things here. We do have portal messages. So we send you a portal message. You get a email saying your lab results are okay and blah blah blah.
Mhm.
We don't call you for everything. That's
Mhm.
how we do things here.
Mhm.
Yeah.
Mhm.
So it's a communication piece. Like, is this a good working relationship? Most of them stay. Some have said, I'm like, that's fine.
That's okay too, right?
So
That's okay.
okay.
It's you always want to be somewhere where you feel appreciated, cared
Yes.
for, respected, and heard. So it may not be with you, it could be with someone else, but overall, I think that's a really wonderful approach. Okay, this has been an amazing conversation, Doc. What is the future of Livingspring Family Medical Center? What's the next phase?
All right, so we're growing pretty fast.
Mhm.
We're increasing our team. We're hoping to increase our team further and maybe expand. Who knows? I don't know.
That's awesome. That's amazing. Maybe you'll come and open up shop in Houston, and you can be my PCP.
Oh, I'd be delighted. You're so
You can
fun.
be my PCP.
Oh my
All
gosh.
right. All right. I'm sure everyone wants to know, where can they find you? I know you're big on YouTube. You do a lot of educational. Tell us, where can everyone find you?
So I'm on the web, www.livingspringmedicals.com. That's livingspringmedicals with an S.com. I'm on YouTube. You can YouTube Livingspring Family Medical Center or Dr. Olabintan. I'm also on Instagram and TikTok, and not so much TikTok. But Living Spring Medical is also on Facebook, and then Dr_Olabintan at on Instagram. Yes.
Fantastic. Doc, you will share, I think you've already shared this information with me. We'll make sure we post everything so our patients can find you, learn more about you, learn a lot about the YouTube videos and all the educational stuff that you do on YouTube. It has been a pleasure having you on Back to Basics. Thank you so much for coming on.
Thank you for having me. This was fun.
That's good. Everyone, again, another phenomenal Back to Basics episode. If you're watching this on YouTube, please share it with a friend, subscribe, follow us. My name is Dr. Vivian Asamoah. I am an integrative GI specialist here in Houston, Texas. Our practice really believes in the best of both worlds. We combine the best of conventional GI with the best of integrative and holistic medicine to give you optimal gut health. We'll see you on the next show. Bye-bye.